Hi guys, it's Alexis. I'm going to be doing my newborn assessment with the help of this neonate. This is my daughter's doll. She is a neonate that came out with a lot of hair, so she's going to be helping me. Okay, so let's just get right into it. So during our newborn assessment, we are going to take some measurements. The first one we're going to do is her weight. We're going to get her on an infant scale. This is a scale where she's lying flat. You do want to put tissue paper at the bottom of the scale to protect our newborn for any type of infection. You lie her flat, and you don't want to move away while she's on the scale. If she was to roll over or stretch and fall, you just don't want to do that. So we're gonna get her weight, put her on the scale, and then we will take their circumference, or actually we're gonna do her length. So we would take a measuring board and measure her from the top of her head to the bottom of her feet, and that's gonna give you the most accurate measurement of length. Then we're gonna go and do her head circumference. You grab paper tape measure, and you're going to measure from the top of the eyebrows all the way around, and that is going to give you your head circumference. Then you're going to want to do a chest circumference, and you're going to want to see that chest circumference exceed about 2 to 3 inches from what the head did, and then you will go on to do an abdominal circumference, and that is going to give you your measurements. This helps determine where our newborn is, where their growth is. And then we would do their vital signs. You're going to want to do their heart rate. So you do want to, when you're doing an infant's heart rate, you do want to count out the full minute for respirations and for heart rate. You don't want to do any type of multiplying or anything like that, because there is room for error since they are so new to being outside the womb. So for her heart rate, you want to see about 100 to 180 beats per minute. You do want to count out those respirations for the full minute, like I said. You will take your newborn's temperature. You can do tympanic, you can do oral, you can do a rectum. I don't recommend a rectal. That's just very invasive. There's no reason for it. And I think they rarely do that. But if we were to do an oral temperature, you want to see it to be about 97.8 to about 98 degrees. Let's see. So that's for temperature. You want to go on to look for the appearance of our newborn. That's the color of their skin. Are they pink? Do they have any bluing around their lips to indicate that maybe they need oxygen immediately? Is there any type of rashes on her skin? Is her skin dry? Does she have Mongolian spots? Those are spots that are not harmful, and they do go away by themselves, and that's usually seen in children of color. Let's see. So you do want to see your baby's skin to be pink and healthy. The baby's cry, is it strong? Is it weak? Do you hear crackling or wheezing, as if they have mucus in their chest or any type of fluid in their lungs? You want to just hear how that cry sounds. We do rate the baby. We do an APGAR score, so that's going to be at the 1st and 5th minute of life. The scale goes from 1 to 10. The higher the number, the more healthy, or the healthier your baby is. So for the 1st minute of life, the APGAR score is going to tell us how well the baby did during labor. And then the 5th minute of life, it's going to show us how well our newborn is doing outside the womb. So you do want to see an APGAR score of about 7, 8, 9. That just indicates that our baby is very strong and very healthy. The skin assessment, the pigmentation of our skin, like I said, does it look like it's in a healthy tint? Do you see any bluing? Do you see pink? Do you see any type of lesion? So does our newborn have any damaged tissue? That's gonna show us what our skin looks like. You want to look at her nail beds. What do her nail beds look like? Do they look pretty healthy? You know, like I said, rashing, dry skin, like what does her skin look like? That's definitely going to be something that we look for. Our newborn's head and neck. So we're going to be looking, you know, is our newborn stiff? Do her joints look swollen? Symmetry and balance in the face. If there is not either one of those, you know, that may indicate a disorder, maybe like Down syndrome. You do want to palpate our newborn's fontanelles. You want to make sure there's no bulging of her fontanelles. You want to make sure that you know, it's not sunken in anywhere. Is it firm? Is it flat? That's what we would like to see. We would go on to our we're working our way down, so we would go down to our neonate's eyes. What do we see when we look at her eyes? Is there redness? Is there drainage? When you get your trusty pen light, and you put light near her eyes, do her pupils dilate? You know, those are things that we want to happen. And it does happen. We want to go into her ears. Are they swollen? Is there any type of drainage? Are they red? You know, the alignment, where are our ears sitting? That can also indicate an order if there or a disorder. Excuse me. So then we're going to want to come to our nose. Is there a flaring of her nostrils? That's going to tell us that, you know, the baby's in distress. She probably needs oxygen like now. The mouth, is it blue? That also is an indicator that she needs oxygen. We would take a tongue blade, since she's too young to stick her tongue out or anything like that. We would take the tongue blade and we would gently put it in her mouth, so that way we can, you know, we can see her mouth. Do her gums look healthy? Is it nice and pink in there? Doesn't look like there's an infection in her mouth. What do we smell? Those are going to be things that we're looking at when we look in the mouth. So we're working our way down, and we would get to the heart. Like I said, when you assess her heart rate, you do want to assess for the full minute. We need to know, bottom line, you know, what it really sounds like, no multiplying or anything like that. So you would do the heart rate. You would listen to the rhythm of the heart rate with our stethoscope. What does a rhythm sound like? Is it irregular? And if it does sound irregular, you know, maybe that's an indicator there's a heart murmur there. There's a heart disorder. So we want to listen and figure out what we hear. We're going to go down to her abdomen. Neonate's abdomen, it can extend just a bit, and that's totally fine if we just see it extend a little bit. You want to listen to the bowel sounds. Do you hear the intestines contracting and relaxing? Those are good signs. You want to, let's see, where am I? You want to look at the umbilical cord. The umbilical cord. The umbilical cord, it has 3 vessels. It has 2 arteries and 1 vein. You want to know what that looks like. Is there any redness or drainage around the area? When our neonate has a stool or voids, we want to know, you know, what does it look like? Is there blood in the urine? Is there blood in the stools? Those are things that we want to look for. When we start getting down to our genitalia, you do want to wear gloves. and you know, they are so young, but we still need to respect them. You know, we need to keep them covered. Let's just pretend my baby has been covered. You want to make sure that they're covered and they're not exposed. You know, you need to respect their privacy, you know, even at such a young age. So while we have our gloves on and we're touching around, you know, we want to see, is she swollen down here? Does she have any drainage? If my neonate was a boy, you know, you wanna palpate his testes and make sure you can even palpate them. You know, does it look like when you palpate them, or do you touch them, does it look like the baby is in pain? Those are things that we wanna look for during if the child was older and not a neonate. You know, those are the rectum and the butt, the genitals. Those are all signs that if there's bruising around the soft tissue, that can indicate child abuse. So you do want to report that immediately if you do see bruising on soft tissue anywhere down here. We would go to the spine and the extremities. We're looking around, you know, we're looking around to see if there's any broken bones. Is our baby okay? When we look at our newborn's spine, is it flexible? Is it round? Is there symmetry? Those are all good things that we want to see. You know, their spine is very flexible since they're just so new, and as they get older, it's gonna you know what I'm trying to say. You want to look at the hip and look for to see if there is a hip or you want to look at the hip placement and see if our hip is dislocated. So yeah, like I said, you know, broken bones, you want to just make sure, you know, our extremities are okay, you know, they're able to move, they're not stiff. Coming down to since we went from the head to the toe, we are gonna go through our 4 reflexes. These are the last things that we're gonna look at. It's Moro. I don't even know if I'm pronouncing these right, so excuse me. I'm always reading these words and not really saying them out loud. So I believe the first reflex is Moro, Palmer and plantar grasp, the rooting, and the Babinski. So the Moro is the startled reflex. So if the baby was to hiccup and the neonate scares herself, does she extend her extremities out and then back into the side? That's one reflex. The other is the Palmer and the plantar grasp. So if I was to put my finger in her hand, if she grasps it really tight, it should be pretty strong when she just holds on to it. That's the Palmer and plantar grasp. The rooting, if I was to like gently stroke our neonate's cheek, will she bring her head to where she feels the reflex? And does she open her mouth? This is a reflex we want to see. You know, it's good for when the mom is breastfeeding, so that'll show us, you know, she has that reflex. And then the Babinski is when we gently stroke her heel from her toes to her foot. Does her big toe go upward, and then her little toes, do they fan out? This reflex will actually disappear as she begins to walk, so she won't have that reflex anymore once that begins. So that's exactly what I would look for in my newborn assessment. Definitely give me feedback. I would appreciate it. I'm not sure if I missed anything, or if there's something that you guys would do differently. So yeah, that was me and my neonate. That was my newborn assessment. Tell me how I did, guys. Thank you.